We're good? Okay, great. Okay, so as I said, I will be talking today about alternative medicine. Why is it interesting? Why talk about it at all? Well, these days, more and more people are turning to alternative medical traditions. And the question is why this is happening. What attracts people to those alternative ways of treating the human body? I think one of the reasons is that gradually people come to realize that a human organism is not just a collection of organs which function independently. It's a complicated system that includes our physical body, our mind, our spirit, and within this complicated system, everything is connected with everything else. And where one organ or one subsystem may affect the condition or the functioning of other organs or other subsystems. So this system requires a holistic approach, but the conventional medicine doesn't treat the whole person, including mind and spirit. Instead, each specialist tends to focus on a particular organ or a particular system. So you have a family doctor whose main expertise seems to be able to correctly match your symptoms with the specialist. Conventional medicine also doesn't focus on prevention, although arguably there are some preventative practices, for example, annual checkups. But for most part, the focus is on treatment, and the tendency is to treat the symptoms and not the underlying cause. Now, this is not to say that the conventional Western medicine should be abandoned. It is very good at dealing with the physical aspect, mostly on an emergency basis, though. It's a kind of heavy artillery. Suppose you broke an arm, or you have an acute appendicitis. In this case, you should not go to a naturopath or do some yoga. You should go straight to emergency. And there is no replacement for the medical procedure in this case. But suppose you have high blood sugar. In this case, you potentially have some options. Now, the most obvious option, a simple option, I would say, is to go see a doctor who will prescribe medications. Why am I saying that this is a simple option? Well, you don't have to make any changes to your lifestyle. You don't have to do anything at all, pretty much. Taking a pill is easy, but there are significant drawbacks. Drugs don't always work. Depending on the specific condition, it is not uncommon for patients to go back to their doctor multiple times until they find the medication that works. Drugs are expensive too, even in countries with universal health care where they're partially covered or maybe partially covered. And also, drugs may cause side effects, which in turn require you to go back to the doctor, take more drugs, and go through the same process multiple times. So that's why some people turn to another option, even though it is much more labor intensive. That is, they try to change their lifestyle. Often this goes well beyond adjusting your diet. Like, for example, in case of high blood sugar, you should start eating less sugar or do other things. Now, another reason for the growing popularity of various alternative approaches is the healthcare system itself. Patients often feel that they're not given enough attention. They're not viewed as individual human beings. They're viewed rather as numbers. They're viewed as part of statistics. Their interaction with their healthcare providers is often impersonal. It's often based on a protocol, and there is no real connection. It's not the doctor's fault. They simply don't have time. They have about 10 minutes per patient. And according to one study I read, on average, it takes 11 seconds for a doctor to interrupt the patient talking. As a result, most doctors don't know their patients. My family doctor certainly doesn't know me. When I first came in, I remember I was given a standard form to fill out. And I know this form is standard because at my previous doctor at a different location, I had to fill out the exact same form. This form has some pretty strange and random questions, in my opinion. For example, how many times a week do you exercise? Well, that sounds like a legitimate question, but they never define exercise. Suppose I walk to my mailbox and back every other day, and I consider this an exercise. But someone else may go for a bike ride for 2 hours every other day. So according to this form, we both exercise every other day. There is another amusing question. How many drinks do you have per week? And obviously, the meaning alcoholic beverages. First of all, most people can only give an approximate answer to this question. Second, while the form is so particular about alcohol, there is no question about how many soft drinks I have per week, or how much sugar I consume, or how many times a week I eat at McDonald's. This is obviously not important. Of course, when I show up carrying an extra 20 pounds around my waist and I have a shortness of breath, then it will be the time to ask me those questions. But until then, this doesn't matter. My doctor also doesn't know that I'm a vegetarian. This question wasn't on the form and she never asked me herself. So the only dietary thing that matters for my health is alcohol. The rest is unimportant. Now, because doctors don't have time, and also because of this overwhelming bias within the Western tradition in favor of hardcore science, let's put it this way, as opposed to human touch, so to speak, doctors tend to rely too much on test results, on numbers, etc., and too little on their knowledge of the patient, on their intuition and their experience. So if the test results are normal, the patient is sent home, even if they do have symptoms. It's all in your head. Maybe it is, but this doesn't solve the patient's problem. And so that's why, in my opinion, many people look for alternatives to this conventional approach. And naturopathic medicine is one of such alternatives. It was brought to North America from Germany in the 1800s, but some of its treatments are centuries old. Today, naturopathic medicine combines traditional treatments with modern science. It uses natural remedies to help the body heal itself. It embraces many therapies, including herbs, massage, acupuncture, exercise, and nutritional counseling. Naturopathic medicine adopts a holistic approach. In other words, a naturopathic doctor will address your physical concerns in connection with your mental and spiritual condition. So in the context of your overall well-being. He or she will take time to get to know you and to learn about your lifestyle, about your diet, your sleep pattern, and various stress factors in your life, as well as your coping strategies. How you deal with this stress. Based on this examination, your naturopathic doctor may also order some lab tests. Now, naturopathic medicine is becoming more and more popular, but there are still many misconceptions around it. For example, people believe that naturopathic medicine is not regulated, and naturopathic doctors do not go to school. So pretty much anyone can set up a shop and start practicing. Well, this is not true. Naturopathic doctors, or NDs, go through a rigorous 4-year study program at an accredited school. In Canada, this is Canadian College of Naturopathic Medicine. And this is a graduate program, which means that an applicant to a naturopathic program has to have a bachelor degree, usually in sciences or kinesiology or biology or something else. Then at least 2 years are spent studying the same biomedical sciences that students at a medical school study. And these students learn to assess and weigh the evidence base as part of developing patient treatment plans. And these are trained as primary care providers. They perform procedures that a family doctor performs, for example, a breast exam or a pap test. In addition to medical subjects, NDs also study nutrition and psychology, something that medical students don't study in depth. I was told, for example, that medical students only have 4 hours of nutrition. You may ask, why would my family doctor need to know about nutrition? He or she will simply send me to a registered dietitian or nutrition specialist. Well, sometimes this knowledge is useful. For example, if you ever had to take iron as a supplement, your doctor probably recommended that you take this iron with orange juice. This is because they know that vitamin C facilitates iron absorption, which is true. But what medical doctors don't know is that there is not nearly enough vitamin C in a glass of juice to make any difference. If you really want to aid iron absorption, then you should take your iron with 1,000 milligrams of vitamin C. By the way, don't take it as a medical recommendation. If you do need to take iron and you're interested in this, please go see your naturopath or your doctor. This is a disclaimer. Well, going back to the story, you may say, well, this is not exactly a life or death situation. That's really a small thing. No, but this is an example of a recommendation given on insufficient knowledge, based on insufficient knowledge. Now, before they're permitted to practice naturopathic medicine, graduates of naturopathic programs in North America have to pass a licensing exam called the Naturopathic Physician's Licensing Examinations. This exam is administered by the North American Board of Naturopathic Medical Education. Another misconception, which is very common, is that naturopathic medicine is not based on science. People think that this is some kind of voodoo stuff steeped in folklore and fairy tales. Well, this is also not true. Naturopathic schools conduct primary research in natural medicine, and the results of this research are published not only in specialized journals, such as the Journal of Chinese Medicine, they're also published in more general journals, such as Antiviral Research. This is the Journal of the International Society for Antiviral Research, or Yale Journal of Biology and Medicine. In 2013, the Canadian Medical Association Journal, which is a peer-reviewed general medical journal published by the Canadian Medical Association, published an article that showed that patients who received naturopathic care in addition to conventional care significantly reduced their risk of dying from a heart attack or stroke compared to those patients who only received conventional care. Now, this publication brings me to yet another misconception about naturopathic medicine. Many people believe that a naturopathic doctor will force you to choose between the conventional and the naturopathic treatment. Now, as this publication in the Canadian Medical Association Journal shows, this is not true. Naturopathic doctors often work as part of a healthcare team and successfully provide patient care in integrative settings, working together with medical doctors. And one of the first questions a naturopathic doctor will ask you is who your family doctor is. And if you don't have a family doctor, they will urge you to find one. And they will explain to you how important to have a family doctor. Now, when it comes to conventional medicine and naturopathic medicine, there is also this double standard. Naturopathic medicine comes under fire whenever a particular treatment plan fails or a particular doctor engages in unethical practices. Often the tendency in such cases is to dismiss the entire field. This doesn't happen, however, with conventional medicine. Unfortunately, we all know that medical doctors do occasionally get suspended for unethical behavior or due to incompetence. And as tragic as it is, patients do die in hospitals and on operating tables. But no one says that the medical profession is just a bunch of lunatics or that liver transplant surgery is a hoax. But despite these and other misconceptions, naturopathic medicine is gradually becoming more and more mainstream. more and more people turn to naturopathic doctors for complementary care. Some employers already today provide benefits that cover naturopathic services, York University being one of them, by the way. I've heard that at least in Ontario, there is talk of integrating naturopathic doctors into the conventional healthcare system and extending the OHIP coverage. This is for those people who don't live in Ontario. This is the provincial healthcare insurance. So extending this provincial healthcare coverage to the services provided by naturopathic doctors. These changes may be a long way away, but in my opinion, this option is certainly worth considering. Thank you.